I'm Dr. Bill here for a Sneez Medical Minute to talk about flu and its symptoms, how it classically presents. Usually there are four main symptoms for most people with the flu. They tend to have fever, they tend to have a headache, joint pain, and lots of fatigue or tiredness. Now, here's the key point for you to know. Many children do not exhibit all of those classic symptoms. Most children will have fever, most will be very tired, but some will also have cough, runny nose, and no joint pain at all, interestingly enough. None of that overall body achiness that's so common in adults. And I'll also tell you this, younger children can have much greater variability in symptoms. Almost all of them have a really high fever, and a few can have a seizure because of the flu itself. And many really small children and infants will have GI symptoms too, like vomiting or diarrhea. So the symptoms vary a lot based on age. It's very important to check your child out if you think they are showing those symptoms. Most of the time the flu lasts roughly a week, with some of the tiredness and cough continuing on past that. It's also very important to know that secondary infections are very common. So primary infection is the flu, secondary infection is one on top of that. So things like ear infections and pneumonia are fairly common with the flu. So what you need to know is that most children improve during the third, fourth, fifth day of the flu. And if it seems like instead of improving, your child is actually getting worse or showing any new symptoms, then you need to contact your healthcare provider right away. This is Dr. Bill, and that's your Sneez Medical Minute.